I think like anything else in medicine, there are several challenges that we face on a day-to-day basis. The reimbursements for procedures is a major problem across the globe, and access to care for patients is a major problem across the globe. There are several social determinants of health, and there are several determinants of access to care that I think need to be addressed to really take electrophysiology to every nook and corner of the world. Are we better today than where we were 10 years ago or 20 years ago? Absolutely yes. Can we do better in really improving the overall access? And this is where organizations like Heart Rhythm Society are doing an excellent job in really expanding on their global strategy to really level the gap, provide more opportunities for training for younger generations of cardiologists to be electrophysiologists so that the field can continue to grow and move forwards. The other challenge that I see for medical innovations in general is the factor of the incremental value addition quotient. That is, for a delta increase in the cost of a new technology, a new disruptive technology, what is the additive benefit and safety? Something that we all have to be cognizant about. But again, disruptive innovations comes from various places, from different angles, and it is the bounden duty of the clinician scientists to really figure out these details and then be able to introduce these novel things into clinical practice. I think that's the most exciting opportunity that I see in general on a global scale. What makes me passionate about what I do? I think electrophysiology is the most amazing field in the world, and there is nothing else I would want to do beyond that. So it's interesting you asked me that question, because I had a young man who wanted to shadow me the other day. He was finishing up his college and he was thinking about going to medical school. And so I asked him to show up in my lab and hang out with me in the operating room for the whole day. So we started the day at 7 and we didn't finish it until 7:30. But what's amazing was this young man was with me those 12 and a half hours on his feet wearing lead, and it didn't really phase him out. And so he asked me a question, so do you do this every day? I said, yes, most of the days, my days are 12 hours. And he goes, how do you keep up? I mean, I keep up because I love what I do, right? So I think that's pretty much everybody that loves doing what they do are the ones that are passionate about it, and it's exciting. It's equally humbling to be in a field that is so vast and intricate and so complex.